My name is Dr. Al Benson, and I'm a professor of medicine and a GI medical oncologist at the Feinberg School of Medicine of Northwestern University and the Robert H. Lurie Comprehensive Cancer Center. One point to emphasize for patients with neuroendocrine tumors is that this represents a spectrum of diseases, and it also represents a high degree of variability. And so we can have the gamut of patients, those who have very low volume disease, who have well differentiated tumors with a low Ki 67 and low mitotic index, who have no symptoms and whose course of disease can be very, very slow. At the other end of the spectrum, we can have patients with poorly differentiated neuroendocrine tumors who have rapid disease progression and who may not respond well to any intervention. And through the years of evaluating and treating patients with neuroendocrine tumors, I think I've seen the whole spectrum. And I can think of some cases that have been highly unusual, even for those individuals with low volume disease. For example, I recently saw one of my patients who reminded me that it was our 25th anniversary in terms of meeting and managing his disease. And this is now a 61-year-old man who has had metastatic neuroendocrine tumor to the liver. He presented with a ileocarcinoid that actually had been resected. And his liver disease is low volume. It was biopsy proven. Over the years, it has maintained positivity, most recently utilizing a gallium-68 dotatate PET scan. And he has been on octreotide for nearly 25 years with total control of his disease and without significant symptoms. He occasionally will have a little flushing. He occasionally will have some diarrhea, but overall, he's tolerated long-term therapy and has had excellent control of his disease. In fact, he's been so stable. I now repeat his imaging, usually with CT scan about every 9 months, and he would certainly call me if he developed symptoms. I also have a recent case of an individual who has high-grade neuroendocrine tumor who actually got an unbelievable response to carboplatin and etoposide. She did have fairly low volume disease, but the only disease that we could visualize currently was isolated liver metastases. So we actually treated that with stereotactic radiation, and she is now way over a year, almost 2 years, with excellent disease control. And this is not what I would expect from someone who has a high-grade neuroendocrine tumor, since many of these individuals have extensive metastatic disease. And although they may initially respond to treatments like carboplatin and etoposide, and perhaps even to temozolomide and capecitabine, they do eventually progress and tend not to have long periods of disease control. So I do emphasize to individual patients the variability. Many people ask me, how long can you control the disease? How long can I survive this? And it really does take a step-by-step careful monitoring of individuals, and sometimes we're surprised how well and for how long an individual patient can have their disease and maintain really excellent performance status and live their lives fairly normally.